Hello everyone, my name is Learn about the RCH program phase 1. It is continuation of the National Family Welfare Program. Under the RCH program phase 1, various provisions were made to improve the status of maternal and child health. Okay, so there are so many services they are producing for improving the maternal and child health. In that, provision of essential and emergency and essential care. Okay, so they are providing the emergency care. Okay, now in the primary health center, in community health center, the emergency care is also provided by the health personnel. So they can improve the status of maternal and child health and provision of equipment and drug kits to selected PSC and selected FRUs in all districts. Okay, so they also covers the districts in that they are providing the essential equipment which are needed for their any procedures or any treatment. Okay, like a tuberculosis drug kit they are provided, then some equipment for delivery, then for care of the child. So these all things are provided at the selected primary health center and the selected first referral unit of the all district. Then provision for additional ANM staff nurse and laboratory technician for selected districts. Okay, now they are recruited so many ANM staff nurse and laboratory technician for the some selected districts. Then they also give duty to them at some district for to provide the maximum care to mother and children. Then laboratory technician provision for 24 hours delivery services at PSC and CSC. As it said that nowadays primary health center and community health center both are having 24-hour delivery services. Okay, so if any woman who is in the labor stage, so they can go at the PSC or CSC which is near to her home. So the base delivery services can be provided at nearest of her home, like PSC and CSCs, and it is for 24 hours. Then next is referral transport in case of obstetric complication. Okay, if there is any obstetric complication or some woman who is having the complication during the labor or the delivery, so she will transfer to the another higher level hospital like community health. If she is admitted in the PSC and she is having any complication, so she is directly referred to the community health center or civil hospital, and she has also provided the referral transport like ambulance or any van to transporting system. Then next is immunization and oral rehydration therapy. Okay, so these things are also included. Then prevention and control of vitamin A deficiency in children. Okay, for this also focus on the control the vitamin E deficiency. Okay, so if any children is having vitamin A deficiency, so they are giving them such a medication to prevent and control them. Then integrated management of childhood illness. Okay, IMCA. Sorry, IMCI. Then this also focus on the childhood illness, and they just assess the baby, okay, assess the children, and they just provided the immediate care to prevent and manage that disease or illness. Then district survey for focused intervention to reduce IMR and MMR. Nowadays, there are so many surveys which are take place in the community or any district. So, district surveys are also take place for to focus on the intervention. Okay, so planning for to reduce the IMR and MMR, and it also be beneficial to the districts. Then new initiative undertaken during phase of RCH, phase 1 of RCH. What are the new initiatives? So in that, first is the setting up of blood storage unit at FRU. Okay, so FRU means the first referral unit. So there is availability of the blood storage. So if any person is having the deficiency of blood, if any people is suffering from if any people is coming with the chronic accident or severe accident, so they can be provided emergency blood to his or her. So the blood storage units are also available at FRU. Then training of MBBS doctor in anesthetic skill for emergency obstetric care at FRU. Now the MBBS doctors are also trained for the anesthetic skill in the emergency obstetric care. If in any condition there is anesthetics are not available, so MBBS doctors can also perform the anesthesia for the emergency obstetric care. Then next, lacunae of RCH1, they were as follow. The outreach services were not available to the vulnerable and needy population. So there are also some services which are quite deficient or quietly not available to some person, like in the vulnerable or whoever those who need that services at services, but they can't get that services because they are not that services are not available. Okay, so this is then the management of financial resources were inadequate. Okay, the financial resources are not adequate in the management. Okay, if we want to manage something, then we also need the financial resources, but at some extent the financial resources also were inadequate. Then human resources such as doctors, nurse, health worker, etc. were deficient. As we think about the human resources like the doctors, then staff nurse, then health workers like FSW, MSW, okay, MPSW. So these all are very useful for providing the care in the community. But at some extent, these human resources are also deficient. Okay, in the RCS phase 1, then the management information and evaluation system was lacking. Okay, the system which provide the information, okay, which done the evaluation of the community, but they are also lacking in the system. Then the effective network of first referral unit was lacking. Okay, then quality of services in PSC and CSCs was poor. Okay, in the last years or before years, the quality services are not provided at PSC and CSC. Okay, if any people and if any person is going at PSC or CSC, they can't get a sufficient care which they needed. Okay, so this also should be improved. Then lack of community participation, and there is no any type of community participation in the RCH1 because we only just focus on something. Okay, so Community participation is a most and crucial part of the any program. But in this phase, the community participation is also late. Okay, these all are the things which are not fulfilled by the RCH phase 1. Then next we will see about the RCH 2. RCH 2 was started from 1st April 2005 up to 2009. The RCH 2 vision articulates improving access, use and quality of RCH services, especially for the poor and undeserved population. Mainly, this also focus on the use and quality of this improving access and use and quality of RCH services, especially mainly this thing are focus on the uh, people who are very destitute. Okay. Then aim of RCH2. What is the aim? To reduce the infant mortality rate, maternal mortality rate, total fertility rate, and increase couple protection rate and immunization coverage, especially in rural area. Okay, what are the aim of this? So this is also focus on the reducing mortality, infant mortality, then maternal mortality, then total fertility rate, and it also focus on increased couple protection rate and immunization. Okay, nowadays all child who are all newborn baby and you need to get the accurate immunization. Okay, so this thing is useful in then what are the objectives of RCH2? So first is to improve the management performance. Okay. RCH2 mainly focus on the management that if management is good, then all things will be good. So this thing is focus on to improve the management performance, then to develop human resource intensively. Okay. As we know that in RCH1, human resource were lacking. So this RCH phase 2 is focus on this also that to develop human resource like staff nurse, doctors, then health workers like MBSW, then FSW. Okay, so they focus on that. Then to expand RCH services to tribal areas also. Okay, RCH services uh, made available into the tribal areas. Then to monitor and evaluate the services. Which services? Those services who are giving, which are provided to the people. So after they provide that services, they just evaluate and monitor that if there's this service if is effective or not. Then to improve the quality, coverage, and effectiveness of the existing family welfare services and essential RCS services with a special focus on above mentioned EAG space. Okay, so mainly how the quality is improved and how this effectiveness will be seen by the people. So for that they just focus on the following this all four objectives. Okay, and if these four objectives will be fulfilled, then all the quality of life will be improved. Then what are the components of RCH in their population stabilization, maternal health, newborn care, child health, adolescent health, control of RTI, STIs, urban health, tribal health, monitoring and evaluation, then other priority areas. Then first is the population stabilization. As per the name, population stabilization means to stabilize the population. Okay, by increasing the number of trained person like medical officer of PSC and female health worker of sub center. Okay, if they are available at the community health center of PSC, so they can provide the education related to family planning and how to use and what are the benefits of it. So increasing the number of trained persons and covering the services at grassroots level. Okay, so services which are provided. So all services provided at the grassroots level, means deeply level. Then involve panchayati raj institution, urban local bodies and NGOs. Then by training one couple from each village to provide non-clinical family planning method services. Okay, then one in that the one couple is selected, and they that couple should be trained, and after that they just provide the non-clinical family planning method at the each village. Then okay, from the each village one couple is to be selected, and they will trained by the health personnel, and but for the effectiveness of the family planning method this should be done. Then by involving district urban development authorities, cooperative societies and industrial workers in providing family planning services, and by identifying NGOs to provide financial, technical and managerial support. Then what second one is the maternal health or reproductive health. In that there are mainly two strategies. For first is the essential obstetric care, and second is the emergency obstetric care. Okay, as per the maternal health and reproductive health. Okay, so maternal related essential obstetric care and emergency obstetric care. In the first is the essential. In that 3 or more antenatal checkups, then 2 doses of tetanus toxoid, 1 pack of iron folic acid tablets during the last trimester, counseling on promoting of institutional delivery. Okay, so woman should be done more than 3 checkups of antenatal during the antenatal period. Then she should be taken the 2 doses of tetanus toxoid. Then they will provide the iron and folic acid tablet or also the calcium tablet. Okay. Then counseling on promoting of institutional delivery. Okay. The woman should be encouraged for institutional delivery. Then the second is the emergency obstetric care. In that, this consists of operationalizing the first referral unit to be fully functional round the clock 24 hours. Okay, this service is to be available for 24 hours. Okay, first referral unit. It is an upgraded PHC or CSC into a 30-bedded hospital having a well-furnished and equipped operation theatre with a newborn care corner, a labor room, blood bank and laboratory to provide the services of obstetric emergencies such as cesarean section and adequate supply of drugs to the patient, care of sick children, family welfare services. Okay, so this is the description of the first referral unit. So this first referral unit is the upgraded PSC or CSC, and it is 30 bedded. Then it is well equipped with the operation theatre with the newborn care corner, then labor room, then blood bank also available, then laboratory also available, and the provide the obstetric emergency care at that PSC or CSC, and also cesarean section should be performed. Then adequate supply of drugs. If these all services are provided at the PSC or CSC, then it's called the first referral unit. Then newer scheme. Okay, there are several schemes in that Janni Suraksha Yojana, then Prasuti Araikar, then training of traditional birth attendants, then training of MOs in the scale of obstetrical management. Okay, these all things are for the for the mothers or the pregnant women. Okay. Then next is newborn care and child health. So as per the name, newborn care and child health. Okay, so they are focused on the newborn and child. The effective health intervention for the newborn, starting from the antenatal period, intrapartum and immediate newborn care, early newborn care and late newborn care. Okay, as I said that it focus on the newborn. Okay, so early newborn, then late neonatal care, these all things are provided. Then Navjat Shisu Suraksha Karyakram, means that the main aspect of NSSK are prevention of hypothermia, prevention of infection, early initiation of breastfeeding. Okay, after the birth, the baby should be um, covered with the towel for regulate the temperature. Okay, so and by that covering, we should prevent the hypothermia. Then baby should be clean with the clean towel. Okay, so by that we can prevent the infection and the early initiation of breastfeeding. Okay, as we know that the initiation of breastfeeding is most needed for the baby, because the first breastfeeding is enriched with the immunoglobulins, and it provides the immunity to the newborn. Then next is facility based IMNCI. In that, it focuses on providing appropriate inpatient management of the major cause of neonatal and childhood mortality. So, IMNCI mainly focus on the neonatal and childhood mortality. Okay, and what are the causes of that? What diseases are occurring in the childhood? What diseases cause death in childhood and neonate? They only focus and try to manage them. That after they find out that cause, they find out the treatment and management of that diseases. So, in the next generation or in the next baby, they can prevent them. Then seek newborn care, then home-based care. Next is the adolescent health. Okay, adolescent health means it focus on the adolescent. This is implemented on pilot basis in those districts where more than 60% girls marry before age of 18 years. Okay. Okay, adolescent health mainly implemented at the area where the 60% girls are married before the 18 years. Okay, because the 18 years is the uh, age which below the 18-year or 18-year, that age is not for marriage. Okay, so these things are implemented on that area. Then the adolescent health services are provided by counseling once in a week in the PSC and CSC. Okay, adolescent should be come at the PSC and CSC, and after they are coming, the services should be provided, and the counseling of that girl or the counseling of adolescent should be done. Then the services are management of menstrual disorder, nutritional counseling, counseling for sexual problems. Okay, so what services are provided at the PSC? So first is management of menstrual. Nowadays there are so many menstrual complications also arising. Okay, so first is the management is menstrual disorders, then nutritional counseling. So many girls having anemia and very disorder which is arising by the nutritional deficiency. So they also be encouraged for the taking high nutrients food. Then counseling for sexual problem. Okay, there are so many sexual problem also, so they are also educated for it. Then next is urban health. In that urban health, this is improved by providing quality primary health care to the urban poor by establishing urban health center. Ratio is 1 gem 50,000 population, where 1 M 3 to 4 ANM lab assistant, 1 public health nurse, 1 clerk, 1 PU, and 1 chowkidar. Okay, so in the urban area, there is also one center is they established, and the center name is Urban Health Center USC, and the ratio of that is 1 gem 50,000. Okay, means in the 15,000 population there is one urban health center should be available, and it is mainly mainly established for the providing the quality of care in the urban area, urban poor area. Then in that staffing pattern is one medical officer, then 3 to 4 ANM staff are available, then lab assistant, one lab assistant is available, then public health nurse, one clerk, one queue, and one chowkidar. Then next is a tribal health, vulnerable population. That in this, as you can see in the picture, okay, these are the people who are underserved due to the problem of geographical access and those who suffer social and economical disadvantages such as SC, ST and the urban poor. Okay, those who are SC, ST and urban poor and those who are having the social and economical issues. Okay, they are not having enough or good economical status or social status. So these things, at that area, the tribal health services are provided. Then next is a monitoring and evaluation. In that, management, information and evaluation system. This is done by following measure. In that, planning is done at various level of sub-center, PSC, CSC, district and state. Okay. So before providing any services, the planning must be done. Okay. So at the PSC, at the CSC, as the sub-center, as the district, at the all level, the planning is done. Okay, and that planning is very different. Okay, not the same planning is done at the whole sectors. At their level, the planning should be different. And monitoring is done by establishing consumer need assessment approach cell at district and state level with an officer in charge. Then evaluation is done through district survey, national family health survey, focus study, and central census report. Okay, so monitoring mainly done by the consumer need assessment approach cell and this at district and state level, and evaluation mainly done by the district survey, done through district survey, national family health survey. Okay, so several surveys are conducted for the evaluation. Okay, without survey they can't evaluate the community. Okay, so with the survey, different type of survey, they evaluate the community. Okay. Validation is done by supervision and surveys. Okay, and after the supervision, after the survey, okay, they just validate that thing. Then last is the other priority area. In that, the services provided under RCH2 are health education, TB control program, store and distribution of anti-malaria drug, ANC services, contraceptive distribution, and referral for terminal methods. As you can see that what are the services which are provided under the RCH phase 2. So in that, first is the health education. They provide the health education to the adolescent, to the mother, then to the school. Okay, so these health education are included. Then TB control program. Okay, nowadays revised national TB control program. Okay, tuberculosis control program is also established to control the TB. So this thing also included. Then store and distribution of anti-malaria drug. Okay, if any person is having malaria, so they are provided the anti-malaria drug, and if they also health personnel also done the survey once a month. Okay, and after the survey, if anyone having the symptoms of malaria, they also get the medication for malaria. Then ANC services. Okay, ANC services are also available at the PSC or CSC. Then contraceptive distribution. Okay, contraceptive devices are distributed at without any cost. Then referral for terminal method. Family planning, which is already I made the video on that, so you can prefer that. Then last is what are the role of nurse in family welfare program. As we know, there are so many roles, okay, like the motivator, then collaborator, then as a teacher, okay, caregiver. These all are the role of the nurse in family welfare program. Like that, motivation is of eligible couple on family welfare methods. Okay, nurses should be motivate the people or motivate the couple for family welfare methods like or family planning methods. Then follow up of IUD and oral pill user. Those who are using the IUDs, okay, property, IUDs, intrauterine devices, okay, this and oral pills. So nurses should be done the follow up for them. Organizing special camping, domiciliary services for perinatal care. Nurses should also done and organizing special camping for the like Mamta. As we know that Mamta Day is celebrated at the sub-center level. Nowadays is celebrated in the health and wellness center. So at that center they should be organize special camping for the BP measurement, then diabetes measurement, then hemoglobin measurement. Okay, so all women or men can come at that. Then domiciliary services for perinatal care. Okay, all the prenatal, then intranatal and postnatal. All women who are in the in perinatal stage, they can get the domiciliary services by the nurses. Then educational activities. Then record maintenance. Okay, this is the main important thing. Then nurse should do. Then whatever he or she do, if she provide any type of services, they should be recorded. Then maintaining adequate supplies. Okay, if any type of services are available at SC or CSC, so she or he should be maintain the adequate supply, that all get the equal benefit of that resources. Then evaluation of program. Okay, if any program is conducted, then she should be evaluate them. Thank you.